Is this spotting or a period? Is this spotting or a period? In this video today, we are going to answer the question, what is the difference between a period and spotting? You are a woman and you are experiencing changes in your system. You are seeing something that is disturbing you and you are asking yourself, is this spotting or a period? Gerard Massa, the health educator, is the name of the channel, and on this channel we do create awareness about fertility and reproductive health. Mu video yaffe eno leero tugenda kwogera ku njawulo ki eri mu kubanga olabye omusaayi nga gwa periods oba olabye omusaayi naye ng'ate tukiyita spotting, ng'ekyo ekibaddewo tukiyita spotting. So without further ado, we shall go straight away to the periods. We are going to answer this question in two parts. We shall first of all discuss part by part. We shall look at the periods, what happens during the periods, and then we shall also discuss spotting, what happens during spotting. The most important thing we need to take from this video is that the difference is always there, much as you'll be seeing blood on your pant liners or you'll be seeing blood on your knickers as a woman, but always there's a difference. Now, during periods, or how do your periods happen? We've talked about the anterior pituitary gland. This is a part in your brain which is responsible for releasing hormones which are actually chemical messengers in your body. Hormones are chemical messengers in your body. What they do specifically, they bring about changes. The hormones for the breasts, specifically it's called prolactin, the hormone for the breasts, when it is released in sufficient quantities, it brings about changes. In the physical, you'll see your breasts being normal. If it is released in excessive quantities, then you will actually experience also changes in the physical. But today we are not talking about changes of prolactin. We are talking about, is it spotting or a period? What's the difference between spotting and a period? So when the anterior pituitary gland, this is a part of your brain, when it releases the hormones FSH and LH, these hormones travel to your ovaries and they actually bring about changes. Now, we shall understand that for periods to happen, there should be actually changes in your hormones. The first hormone we are looking at is the hormone known as estrogen. Estrogen, abbreviated as E2, some doctors call it estradiol. In most cases, when it is released in sufficient quantities, you will not see your periods. But when it rises, that is after the second 2 weeks, let's say you started your periods today and then you actually finished the 2 weeks, on the 14th day you're going to be ovulating. But after ovulation, the next 2 weeks, that phase of your menstrual cycle is what we call the luteal phase. So when the estrogen hormone rises and then maybe you did not get pregnant, this estrogen hormone is going to drop. The levels of estrogen are going to drop in your body, and what is going to happen is that when the levels of the estrogen hormone drops, then also progesterone is also going to drop, assuming that you were not pregnant. Because if you get pregnant, the levels of progesterone hormone are going to continue rising. They will be produced by a particular part which is known as the corpus luteum. But today we are talking about periods. We shall not go into that. So what we need to take from this video is that spotting and periods, there's always a difference. We are talking about periods, how they happen. We've said that these periods happen because when you were expected to get pregnant and you did not get pregnant, the estrogen hormone is going to drop. The levels of estrogen hormone are going to drop. And when they drop, automatically the inside of your uterus or your uterine lining is going to shed. It's going to shed itself, and that shedding is what we call periods. So the shedding or your periods are normally heavier, and whereas in spotting there's always light bleeding, which actually may be having also a light color, and it lasts for only 1 day or 2 days. But also we need to take note that the biggest difference between periods and spotting is that in spotting there's light bleeding, and the color is always lighter. Whereas in your periods, if you are experiencing your periods, ideally the bleeding is going to be heavy, whereby it will actually fill up a tampon or even your sanitary pad. So the first difference between periods, or the first way you can tell that this is your periods or this is spotting, is that you look at the heaviness and then you look at the color. One is lighter, then one is darker. If you are a woman out there and you are experiencing heavy bleeding 2, 3, 4 days, then this could be your periods. But remember, if you have been having normal periods and then all of a sudden your periods have gone to 1 day, we've done a video about this. You can go to the library after watching this lesson. You can go through that video. But simply we shall talk about it. If you have been having your normal periods and then all of a sudden your periods become shorter, then you do not need to wait. This could be an indication that there's something happening. You could actually be pregnant, or you could be having hormonal changes, or you could be overstressed, or you could be having disease of the womb, and also you could be having an ectopic pregnancy. So whenever you as a woman see blood coming out from your system, whenever you experience bleeding, please do not take it to be just as usual. More specifically, if there are changes in your periods, if your periods become irregular all of a sudden, and then also the periods become heavier than normal, you should have yourself checked out at your doctor. Your doctor should do some tests on you to confirm what could be happening. So the first sign or the first difference between your periods is the heaviness and then the lightness. Tugambye nti omukyala wabanga alabye periods ze, ekisookebwako ekisobola otuleetera okuba nga twawula oba zino periods oba zino si periods, kyekyokuba nti omusaayi oguba gufuluma mu periods guba mungi nnyo nnyo nnyo. Ate of course nti buli mukyala oba buli mukazi afuna omusaayi oguli very heavy, naye nga at least guba mungiko okusinga mu spotting omusaayi guba mutini. So next is we are looking at the signs. What happens when you are going to see your periods? Excuse me. What happens when you're going to see your periods? When you are about to see your periods, normally you are going to experience fatigue. You will actually also experience abdominal pains, or also we call them cramps. And then you could also experience mood swings. But remember, as I said in the beginning, there's a very slight difference between your periods and bloating. So your periods and spotting. So also, if you are experiencing spotting, it could be that still you are maybe experiencing ovulation. It could be a sign, the spotting could be a sign that you are ovulating. The spotting could be a sign of conditions like polycystic ovarian syndrome. Spotting could also indicate that you could be pregnant. And then spotting could indicate that you have fibroids, or even you could actually be on birth control medications, because there are many birth control medications out there. And when you look at the leaflets, you realize that bleeding, or mild spotting or light spotting, is among the side effects of many of the birth control pills. So if you experience breast tenderness, you experience cramps, you also experience fatigue and mood swings, and even you feel abdominal fullness, then there are high chances that you could be having, or you could be going into your periods, although the same symptoms or the same signs are for spotting also. So the only way to differentiate between spotting and periods, or the only way to differentiate, assuming you've gone to hospital and your main complaint is you are seeing bleeding, you are bleeding or you are spotting, what your doctor is most likely going to do, your doctor will first of all request for some tests. The first simple test we normally look at for every woman who is spotting or having heavy bleeding, to differentiate whether this is a pregnancy or it's bleeding due to something else, we do what we call a urine HCG pregnancy test. A urine HCG pregnancy test specifically looks for the hormone. It's known as the human chorionic gonadotropin hormone, HCG hormone. So if this test is done on you, and then it turns out to be positive, then there are high chances that actually you are pregnant. If the test turns out to be positive, you are actually most likely to be pregnant. I'm saying most likely because there are some other conditions which bring about false positive pregnancy tests. These conditions could be that you could be on some drugs which actually can give false positive results. You could also be having some issues like maybe myomas or swellings or tumors in your system. So the only way or the first test your doctor will request is the urine pregnancy test. If it turns positive or if it gives a faint positive, then your doctor will go ahead and request for the serum HCG pregnancy test. By serum, we mean a sample of your blood is taken, around 1 or 2 mils, is taken in a purple top container. Your doctor will do all this, a small container which is always available in hospital. And then this sample will be tested. After being run through a machine known as a centrifuge, still this is more of medical, but just know that a small sample of your blood is taken, and then it will be tested for the same hormone, the HCG hormone. If the serum HCG pregnancy test or the blood pregnancy test turns out to be positive, then you are pregnant. It confirms that the bleeding or the spotting you are experiencing is due to pregnancy. But still, infections like PIDs or pelvic inflammatory diseases do also cause bleeding. They do also cause spotting. So you do not need to sit at home. You should see your doctor who will do these tests. The first test to be done to confirm whether you could be having a PID is that no, it's not the first test. We've talked about the urine pregnancy test. We've talked about the serum or the blood pregnancy test. Now, the third test is what we call the urine analysis test. Urine analysis test. Analysis means that a sample of your urine will be taken in a small container, and then the studies will be done on you. I mean, they will be done on the urine. These tests will be done on the urine to look for changes in your urine, as the word analysis implies. It implies that the whole sample of your urine will be analyzed for changes. These changes could include things like presence of white blood cells, presence of white blood cells. These are also called the leukocytes, depending on the hospital where the tests are being done. And then also, if at all this test is done, the urine analysis test is done, and then your urine report shows that you have pus cells, you have pus in your urine. Though it may not be visible with your eyes physically, you may not be able to see, but under a microscope, under testing in the lab, if at all pus is seen, or if pus cells are seen, then it could also raise question marks. If blood cells are seen in your urine, still it could raise questions as to why you have blood in your urine. And now your doctor will need to do more evaluation on you. And then lastly, the urine analysis test specifically looks at presence of other parameters. For example, if the urine analysis test shows that you have yeast cells in your system, in your urine, then it means that there are high chances that you could be having an infection which is really so serious that it is actually leading to release of yeast cells in your urine. And most likely, this could be a fungal infection. Talking about fungus, fungus is really a stubborn infection. In hospital, it may actually not respond to the conventional antibiotics which are always given. You do the urine analysis test, you do the urine, they call it a test for infection, and then it turns out to be really showing that things are not good. Your doctor gives you antibiotics. You may take antibiotics year after year, but you may not get better. Why? Because what you are taking antibiotics for may not be something that needs antibiotics. It may be something that needs antifungals. So always see your doctor before you actually take any medication. Avoid self-medication. Do not self-medicate. Always talk to your doctor who will advise you, who will give you expert advice. Talking about the last test which will be done on you, if at all the bleeding is there, I mean you've done the urine pregnancy test, it's negative, or it is positive. You've done the urine analysis test, it is also showing changes, or it is even normal. your doctor is going to request for one last test. And so there are other tests which may be done depending on the country where you are, but your doctor will most likely request for a pelvic ultrasound scan, or also known as a gynecologic ultrasound scan. Here, it will give pictures or images of your reproductive system, presence of free fluid in a particular part known as a recto-urinary pouch, or the pouch of Douglas, confirms that you could be having a PID, or also you could be having endometritis. Let me answer all your questions down below in the comments. Ask me all your questions about fertility, and I will be very happy to answer them. Thank you for attending our lesson for today, and see you in my next video. Remember to subscribe so that you do not miss new videos we release every day about fertility and reproductive health. Ovulation is the release of a mature egg known as a Graafian follicle on the 14th day of your menstrual cycle. This egg goes on and it gets fertilized. When it is fertilized, this very egg goes on and grows into a baby. Now, when this egg attaches itself onto your uterine wall or your womb, we call this an intrauterine pregnancy. If this fertilized egg remains in your tubes or your fallopian tubes, then it becomes what we call an ectopic pregnancy. If this egg is attached onto your uterine wall, it grows into a pregnancy. There will be a gestational sac or the sac of the baby, but if the embryo fails to go into the sac, then we call this a blighted ovum. Do you have any questions about fertility? Would you like to know about pregnancy, how you can get pregnant faster? Have you been asking yourself, why are you feeling that abdominal pain? Then you are in the right place. On this channel, we do create awareness about fertility and reproductive health. Gerard Massa, the health educator, are my names, are the names of the channel, and I welcome you for this lesson today. Remember to ask me all your questions down below in the comments, and I will answer all your questions definitely very fast. Thank you for watching today's video. I hope you have learned something in today's video lesson. If you have any question about fertility, about reproductive health, or about how you can get pregnant faster naturally, then just go down the comment section of this video and ask your question. I will answer all your questions. Nsanyusa nnyo mukwano gwange okubanga obadde naffe leero. Oba olina ekibuuzo kyonna kyonna ekikwatagana ku video gy'olabye leero, oba oyagala okubanga nkuddamu, beera nga ombuuza ebibuuzo byo mu comments eza video eno, nja kuba nkuddamu. Remember to subscribe so that you do not miss new videos we release every day. And then also remember to hit the like button so that we reach more people here on YouTube. Have yourself a fantastic and healthy day, and remember to donate to support our work. May God bless and protect us all. Bye-bye.